You probably do not have a clear picture of what your kidneys are meant for. If you did, you'd take good care of them. The truth is, a lot of the problems associated with the kidney are caused by people and can be prevented. I'm sure you've heard about chronic kidney disease before. I will break it down for you to enhance your understanding of this disease that can cause severe damages to your health.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Andrew. Today Michael and I will be covering everything you need to know about chronic kidney disease, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. First off, Michael, tell us a bit more about chronic kidney disease.
Your kidneys act as filters and purifiers. They filter excess fluids from your blood and other wastes, which you excrete as urine. There are conditions that can make it impossible for your kidney to perform. Chronic kidney disease is one of them. Otherwise known as chronic kidney failure, it is the gradual decline in kidney function. When this occurs, fluids, wastes, and electrolytes that are harmful to your body can build up. The tricky thing about chronic kidney disease is that you may not even notice it until your kidney becomes greatly impaired. However, there are a few signs to look out for in its early stages, and we'll talk about them soon enough. It is important to treat chronic kidney disease early, mostly by slowing down the progression to prevent outright kidney failure, which can be fatal. At that point, an artificial dialysis may be required. Other times, only a transplant can help.
What are the symptoms of chronic kidney disease?
As chronic kidney disease progresses, signs and symptoms become clearer and easier to identify. These symptoms may include loss of appetite, it becomes difficult to eat or even feel the urge to eat. Sleeping disorders, too little and often disrupted sleep. Vomiting. Nausea. Feeling of fatigue, feeling tired too frequently and too easily. Changes in urination, either in consistency, frequency, ease and manner, some changes will be observed. Persistent itching. Drop in mental alertness. Swollen feet and ankles. Muscle cramps. Shortness of breath, caused by the buildup of fluids in the lungs. Chest pain, caused by fluid buildup around the heart's lining. Hypertension that is often too difficult to control. You will need to be very watchful and observant. The symptoms of chronic kidney disease may appear as symptoms of other known illnesses. Some other times, it may be hard to tell until the disease has caused irreparable damage. You should see your doctor if you notice any or some of these symptoms. You should also see a doctor if you have a medical condition that makes you vulnerable to kidney disease. Urine and blood tests should be carried out, and you should always monitor your blood pressure during regular visits to your doctor.
Okay. Please elaborate on the causes of this condition.
Chronic kidney disease is a condition that prevents the kidney from functioning properly. It is degenerative in nature and worsens over time, except some immediate medical intervention is sought. There are a number of conditions that can cause chronic kidney disease. These include high blood pressure, hypertension, interstitial nephritis, inflammation of the kidney's tubules and other surrounding structures, type 1 or 2 diabetes, vesicoureteral reflux, a condition where urine backs up into your kidneys, polycystic kidney disease, a genetic disorder where cysts develop in clusters in your kidneys, pyelonephritis, a recurring kidney infection, prolonged obstruction of the urinary tract as a result of conditions like kidney stones and enlarged prostate, glomerulonephritis, this is an inflammation of the glomeruli, the kidney's filtering units.
What are the risk factors that may lead to chronic kidney disease?
Apart from outright causes, there are certain risk factors for chronic kidney disease. Family history of kidney disease. High blood pressure. Cardiovascular disease. Abnormal kidney structure, which can also increase your risk. Diabetes. Obesity. Smoking. Race, just being African American, Asian American or Native American is a risk factor, and old age.
Are there any complications that this disease could lead to?
Due to the importance of the kidney to the overall human health, chronic kidney disease can affect almost all parts of the body over time. Complications include fluid retention, a condition that can lead to several other conditions like high blood pressure, swollen arms and legs, and pulmonary edema, when you have fluid in your lungs affecting your breathing. Cardiovascular disease. Anemia. An inflammation of the sac-like layer around your heart, pericarditis. Weakened bones and high risk of fractures. Spike in your blood potassium levels, which could cause a malfunction of the heart. Pregnancy complications that can affect the mother and child. fertility problems, erectile dysfunction and decreased sex drive. Damaged central nervous system, leading to personality changes or seizures. End-stage kidney disease that cannot be reversed unless through a dialysis or kidney transplant. Prevention. There are a few things you can do to minimize your risk of getting kidney disease. Avoid smoking. Smoking can cause serious damage to your kidney and even worsen underlying kidney disease. If you already smoke, find a way to quit. Your doctor and other counseling groups can help. Be careful with painkillers. The first step is to check with your doctor that these over-the-counter painkillers are good for you. If they are, be sure to follow the instructions on the pack. Taking too many painkillers like aspirin, ibuprofen and acetaminophen can greatly affect your kidney. Watch your weight. If you're overweight, talk to your doctor about weight loss strategies that can help you lose weight. Increased physical activity will also help. And if you already have the right weight, work towards maintaining it. Manage underlying medical conditions. You may have conditions that put you at risk of kidney disease. You should work with your doctor to keep them in check and work out tests to identify signs of kidney disease.
How is chronic kidney disease diagnosed?
Diagnosis of kidney disease can begin with simple things as routine questions at your doctor's, where she may want to find out if there's a personal or family history, whether you have high blood pressure, whether you've noticed changes in your urination, and whether you're taking medication that might negatively affect your kidney. What follows is usually a physical examination. This can be cardiovascular or neurological or both. The goal is to search for symptoms. There are other tests that may be required for kidney disease diagnosis. Urine tests. Here, a sample of your urine is collected and analyzed. This analysis can reveal abnormalities if present. It will not only help to find out if you have chronic kidney disease or not, but may help to identify the likely cause. Blood tests. As we established earlier, poor kidney function leaves impurities in your blood. A blood test should be able to reveal such waste products as urea and creatine. Imaging. Here, an ultrasound is used to assess the size and structure of your kidney. Kidney biopsy. This is another type of invasive test. It is done when it's probably already established that you have some problem with your kidney. It involves the removal of a sample of your kidney tissue to be tested in a lab. The purpose is to determine the cause. A thin needle is inserted into your kidney through your skin. Often, it is monitored using an ultrasound device.
Please tell us about the available treatment options.
I know this is the part you've been waiting for. Treatment varies according to the type of kidney disease you have. Where it is chronic, there may be no cure. The kinds of treatment available for kidney disease are those that take care of the symptoms and complications, as well as halting the progression of the disease. End-stage kidney disease treatment like a dialysis or transplant may become necessary if your kidney is already severely damaged. Let's now put the treatment options into clear perspectives. Treating the cause. For instance, if your kidney is caused by high blood pressure, your doctor may choose to treat the high blood pressure. While this might slow down the progression, it doesn't always stop the worsening of the kidney disease. Treating the complications. Another option is to treat the complications arising from the kidney disease. This may include medications for anemia. Fatigue associated with anemia can be relieved using hormone supplements like erythropoietin to aid red blood cell production. Treating high blood pressure. Your doctor is likely to recommend medications to help lower your blood pressure. Angiotensin-converting enzymes, ACE inhibitors is a good example of such medications. Such medications can initially further decrease kidney function but may help over time. Be sure to keep an eye on your condition through frequent blood tests. Medications for swelling. Fluid retention is one of the complications of kidney disease. The legs might swell as a result and hypertension might be triggered. In this case, diuretics can be administered to maintain your body fluids balance. Medications for your bones. The best bet is vitamin D and calcium, but these should be prescribed by your doctor. This will help prevent weak bones and fracture. You may also need to control the phosphate content in your blood using medications like phosphate binder, in order to prevent damage often caused by calcium deposits. Lowering cholesterol levels. High levels of cholesterol is a common occurrence in people with chronic kidney disease. This can in turn lead to heart disease. Your doctor is likely to recommend medications like statins to bring cholesterol levels to a manageable range. There are other things that can be done, and may not require medications. For instance, you may need to lower your protein intake since your kidneys can no longer effectively filter the waste products that proteins create. Together with your doctor, a dietitian may suggest healthy ways to reduce your protein intake.
What happens when kidney disease becomes irreversible?
This condition is known as end-stage kidney disease. It describes a condition of complete kidney failure or something close to that. Your kidneys can no longer clear the waste and fluids on their own. At this point, you'll need one of two things. Dialysis. The purpose of dialysis is to provide a near alternative to the kidney. The procedure is done to artificially remove waste products and excess fluids from your blood. There are two types: peritoneal dialysis, where your abdominal cavity is filled with a dialysis solution that absorbs the waste and fluids and drains, along with the waste, from your body over time. The other type is hemodialysis, a machine that automatically filters wastes and extra fluids from your blood. Kidney transplant. With kidney transplant, your damaged kidney is replaced with a healthy one, usually from a donor. This donor can be alive or dead. But to enhance compatibility with the new organ, you may have to be on medications for the rest of your life.
Are there any lifestyle changes or home remedies that can help fight chronic kidney disease?
This is a supportive regimen that may be recommended to help you defeat chronic kidney disease. It is meant to help your kidneys and reduce their workload. Do not eat foods with high potassium content. Oranges, spinach, potatoes and bananas are good examples of potassium-rich foods. You should go for green beans, strawberries, carrots and apples instead. You should also avoid salt substitutes as many of them contain potassium. Avoid salted products like canned soups, fast foods, frozen dinners, salty snacks, and processed cheeses. Generally, lower the sodium content you consume each day. Reduce the protein you eat. Ask your dietitian to help create a schedule of the amount of protein, in grams, you can eat each day. Generally, you'll need to avoid foods rich in protein such as milk, eggs, lean meat, beans and cheese, and eat more cereals, fruits and vegetables.
As we wrap up, Michael, tell us about treatment options being researched.
Regenerative options are still being studied and are touted to have lots of potential for future kidney disease treatment. These options include boosting the body's natural healing mechanism to self-heal, delivering certain cells or its products to bad tissues or organs to get them working again, taking only specific tissues, cells or organs from donors to replace damaged ones. Even for those with chronic conditions, research is being done to find ways to slow progression of the disease.
Thank you again, Michael, for that wealth of knowledge on chronic kidney disease. To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the description.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.